One of the other stories that impacted my career and the trajectory of for many patients today is the story of Will. He is a little boy that was diagnosed at Boston Children's when he was 9 months old. He was treated for high-risk neuroblastoma, relapse, went to another institution for a trial, came back with progression, and then at about 3 years of age was recommended to go home on hospice. And I met his father at a conference, and he asked if we had options. His son was still running around and couldn't imagine that there wasn't anything more he could do. So at that time I said, we do have a clinical trial, phase 1, that he could enroll and may give him more time, may give us more time to find other options for him. He enrolled on a phase 1 trial with us for about a year and then had another progression, another phase 1 trial for about a year, and then another progression. At that time, his father had started a foundation, Friends of Will, and they had raised money for us to open another clinical trial with the medication DFMO. So his foundation funded this clinical trial. His son was able to enroll as the third patient on the clinical trial and did well. And did well. And 2.5 years later was still doing well. And we said, I think we can stop treatment. At some point we need to stop. And so we said, let's take a break and see what happens. His tumor continued to regress, and he is actually in college today. So he's really a story that reminds us that hope matters. His father had hope that with additional trial, they would find a treatment that could help him. And we did. It was his father that funded the trial that saved his own son. And we're so thankful for that family, because it really taught us the power of DFMO, that DFMO can help children with cancer. We actually have 3 long-term survivors from that phase 1 trial that led to the phase 2 trial that led to DFMO approval, so that all children across the US have access to this medication now, really because of one little boy.
Wow, go Will.